This is the K8U Patella Stabilizer. This brace is developed for control of patellofemoral issues. If you have kneecaps that sublux or dislocate, or you want to actually use it as a preventative so you don't have any issues with patellofemoral issues, this has been one of our #1 selling products. This particular product is 1/8 inch neoprene. It is nylon on the outside, nylon on the inside. This has 2 straps, and what we do differently than most braces is when you put on a brace for patella stabilization, what you want is to control the kneecap properly. If you do not have an injury but you're using it as a preventative measure, you want a neutral pull on your patella. As you can see, this particular brace, Velcro pulls this direction, this strap here pulls the opposite direction, so you're getting a neutral pull. If you wanted dynamic pull and hold it one direction, then our straps would pull in the same direction. This particular brace is more of a neutral pull. This brace also has spiral stays down both sides of the brace. These spiral stays give rigidity to the brace. It also keeps the brace from bunching up. They're very comfortable. They're between 2 layers of neoprene, so they're not felt. It is padded. On our patella stabilizers, one thing we do differently too is we do not take our straps all the way around the brace. You're trying to control your patella. You don't need to go all the way around the brace to do that. When you go all the way around the brace, you give more of a tourniquet type effect, and sometimes it's very uncomfortable. So we stop our straps behind the spiral stays on both sides and do not continue all the way around the back. We also have a Mauser seam down the back again for strength and durability. It's 4 threads coming in all at one time instead of just a solid stitch or gluing, so there's nothing on the inside to rub or chafe the skin. Again, this brace, we use buckles. The buckles are opposing, just like the straps are. They're not on the same side. This brace also has a universal felt buttress. You reach inside and you can just pull the felt buttress out. You'll notice the stitching on the front of the brace. That is the stitching that sews on the felt or the plush material on the inside that this Velcro sticks to. So if you have a patient that has an inverted patella, you might want to, subluxing patella, you might want to put the patella felt buttress in an inverted position like this with the horseshoe open at the top. If they've had a dislocation where they go anteriorly up and out, or up and out laterally, you would want to put it in a superior position with the horseshoe open at the bottom. Or again, you have the ability to move it left or right. Once you decide what position you want, you just reach down inside the brace with it, stick it to the plush material. If you have a little bitty patella, a small patella, you can actually bring the felt pad, and I'll be able to show you here in the picture, you can bring the felt in closer. You don't have to keep it outside the patella hole. You can actually move it in closer if you want to make this hole smaller right in front to control the kneecap better.